The operation is over. The surgeon steps back, and the surgical tools are set down on the tray. For the patient waking up in the recovery room, there is a profound sense of relief. The hardest part seems to be finished. This 3D model shows the gastrointestinal tract right after an abdominal procedure. The physical reality is severe. The tissue is red, swollen, and stitched together. The normal, wave-like muscle contractions that move food along, peristalsis, have completely stopped. The gut is in deep physiological shock. Asking this traumatized system to digest a standard meal is like forcing someone with pinned leg fractures to sprint a marathon. If solid food enters this paralyzed system, it piles up. The pressure causes intense bloating and a high risk of tearing fresh stitches open. A surgeon can perfectly reconstruct your anatomy in the operating room, but when you leave the hospital, the specific food you swallow acts as your primary medication. If you or a loved one have recently gone through abdominal surgery, drop a comment below with the procedure you had. You're definitely not going through this recovery alone. Post-op nutrition has absolutely nothing to do with losing weight or sticking to a diet trend. It is a strict protocol for mechanical tissue repair and keeping your reconstructed organs intact. The first 1 to 3 days after surgery require a very specific intake protocol: strictly clear liquids. Think water, weak broth, or plain tea. This diagram illustrates why. The GI tract is asleep. Translucent fluids pass through effortlessly, requiring zero contraction and leaving no solid residue. But volume matters. A massive gulp causes stomach walls to rapidly expand, stretching healing tissue. Tiny, spaced sips ensure hydration passes safely. Phase 1 serves a single purpose: gently restarting your biological engine without stalling the system entirely. By weeks 1 through 4, you transition to soft, pureed foods, breaking intake into 5 or 6 very small micro-meals scattered throughout the day. The absolute priority here is protein. Scrambled eggs, soft cheese, and steamed fish provide the exact raw materials your body needs to heal. Taking a closer microscopic view, we can see exactly how this works. The body eagerly consumes the amino acids from that soft protein and synthesizes them into thick strands of collagen, literally welding the torn surgical edges back together. This phase also introduces a strict mechanical roll. Notice how this timer separates the plate of food and the glass of water. You must wait at least 30 minutes between eating solid food and drinking liquids. If you drink water while you eat, the fluid physically stretches your recovering stomach. Worse, it prematurely flushes that unprepared solid food straight into your intestines, causing intense cramping. To further protect the stomach, you have to radically overchew every bite. Breaking the food down completely in your mouth offloads the mechanical work of digestion before the food ever hits your gut. In Phase 2, eating is no longer a passive daily habit. It is an active, calculated biological therapy. There is a common assumption that foods like raw vegetables, fresh fruit, and whole grains are universally good for you. During recovery, that logic goes out the window. High-fiber items like raw cabbage and broccoli demand immense mechanical effort to break down. Because your gut is sluggish, these foods sit there and trigger aggressive internal fermentation. This vector model shows the direct threat of that fermentation. The trapped gas bubbles expand inside the intestinal cavity, applying severe outward pressure right up against your fresh sutures. You also have to eliminate carbonated drinks, heavy fats, and concentrated sugars. In a fragile gut, these trigger a rapid influx of water, leading to severe osmotic diarrhea or dumping syndrome. Looking at this red list of strong coffee, sweets, and raw fruit, which one would you struggle the most to give up? Let me know in the comments. While your internal wounds heal, the definition of healthy eating flips upside down. Easy to digest, highly processed soft food is dramatically safer than a raw, natural salad. Fortunately, the human body is remarkably adaptable. After 4 to 6 weeks, the gastrointestinal tract remodels itself and learns to function efficiently under its new anatomical conditions. In this final phase, you begin to carefully reintroduce complex foods. You add them one by one, waiting days between each new item to isolate what triggers discomfort. Enduring a strict, bland diet for a month feels difficult, but it is never a punishment. It is a deliberate, necessary dose of self-administered medicine. If you've already made it through to the other side of recovery, tell us what your very first normal meal was. It might be exactly the inspiration someone stuck on the liquid phase needs to read today. The success of your surgery isn't entirely in the surgeon's hands. By taking strict control of your plate, you take total control over your healing.